Thanks, Penny, and thanks, Keith. So yes, apologies, I am indeed not Caroline. She's unfortunately not able to be here this morning, but my name's Claire, and I, as Penny mentioned, I manage the training service around self-harm, suicide and mental health for Harmless. Just a brief introduction to our service. We're a user-led self-harm and suicide prevention service, so we do sit in the community third sector, and the picture of self-harm presentation through COVID that I think a lot of us in the third sector have seen is quite the opposite from the statutory sector, especially if you're in a healthcare setting. So I'm going to ask Emma to move forward the slides as we go and give you an idea of what we have seen at Harmless since lockdown in March. So two really important figures that we have seen. We compared a lockdown period versus a comparable period from last year. And one key figure that we have seen is that we have far more people who have been in touch with us. So we've actually seen a 200% increase in service demand. And for us, that means enquiries that often go on to referral points. And that is a huge, significant increase. With our existing client base, we've also seen an additional requirement for support, and that need has kept increasing as lockdown has changed. We know that we're predominantly working in the East Midlands physically, and we have different pockets of local lockdown which are impacting people more significantly. So on average, we've seen a 13% increase in our existing client base requiring more support in between their typical usual appointments. So moving on. What did we do? Well, very quickly in February, March, when lockdown was on the horizon, we knew that we needed to get a response ready. We made sure that we put everything in place to retain a fully operational self-harm crisis and bereavement pathway, but we made adjustments for the remote way that people would need to access our help. With our crisis pathway, we've now very quickly implemented a text service for our current clients to get in touch with us in between appointments. And we wanted to know more, to listen to the user voice really in what they were telling us about their experiences of lockdown and self-harm. So we developed a public survey, which we sent out in July, and we had just over 140 people get back to us to let us know what their thoughts were. So moving on. A couple of things that we found. Number one, we were able to quantify a bit more clearly that increase in contacts. So April alone for us saw 4 times more email inquiries than February and over double the amount of inquiries than we saw in March. So as lockdown rumbled on, the inquiry numbers for us month on month were growing. This is just email inquiries, but obviously we also have inquiries through other means, through Facebook, Twitter, phone, and potentially face-to-face, people just sort of anecdotally getting in touch with friends who are aware of the service. Direct referrals from agencies did decrease in April compared to March, but we expected that might be due to reduced capacity of healthcare services in their ability to respond directly to people. Okay, moving on. Another thing that we found, and obviously this is just a snapshot from just over 140 people, we were asking people about their episodes of self-harm during lockdown, and the most reported shift in what we saw as an increase in frequency was from those self-harming between 1 and 2 times a week up to 3 to 5 times a week. So that seems to indicate a real-world increase, certainly for the people who responded to our survey. Just over 18% of people responded that they went from no self-harm per week prior to lockdown to actually starting to self-harm during lockdown. And that might well be those individuals who were in recovery, as Penny was mentioning, who were actually finding things quite difficult without access to support. So moving on. A couple of more specific figures, I suppose. The 2 figures here that decrease are people self-harming not at all or relatively infrequently. And the significant increases we saw were again in those who were self-harming between 3 and 5, 6 and 10, and over 10 times a week. That bottom figure hits pretty hard. So what we saw was just over 230% increase in those reporting self-harm, more than 10 episodes a week. So moving forwards. So one of the things we wanted to find out was, are people avoiding services now, and are they avoiding them more than they were prior to lockdown? And this seems to indicate that that definitely is the case for those who spoke to us through this survey. Almost 2/3 of people responded they don't ever ordinarily seek medical treatment for their self-harm, regardless of the current virus, but actually 40% of our respondents said that they have actively avoided seeking medical treatment during lockdown for their self-harm when they have needed that medical support. So there is a very real shift here in people actively avoiding medical treatment. And we wanted to find out a bit more about the reasons why. So moving forwards. We asked about GP avoidance and emergency department avoidance, and here we found that just under 70% of respondents said that if a need arose where they did need medical intervention as a result of their self-harm injuries, they would avoid going to a GP, and they would also avoid going to a hospital. And that's obviously concerning because these may have been people who previously would have presented to medical healthcare settings. Okay, moving forwards. So reasons for avoidance during lockdown. Two significant things came out here around not wanting to burden services and perceived stigma. Sense of burden and stigma are massively prevalent around the issues of self-harm and suicidal crisis as well, and mental health more generally. We knew this already. So as Keith was saying, you know, we're building on what we've already know, but actually we've seen an increase in all of those things during lockdown. So 3 out of 4 people didn't attend services for medical treatment due to that fear of burdening services and due to perceived stigma. And some of the comments we received were that people would feel stigmatized in healthcare settings, not understanding them and their presentations, fear of judgment. One respondent really sadly said, what's the point? You know, what's the point in going to them? And another respondent said partly coronavirus and partly prejudice and disrespect from staff and guilt at being a bother when it's self-inflicted. So these are very real points of distress laying behind these very real reasons why people are avoiding services during lockdown. So moving on. A question that we did ask was, if you would be worried about seeking medical treatment due to the virus, why? What would this be specifically because of a fear of contracting the virus or a worry about overwhelming services or other reasons? And overwhelmingly, people responded that they were concerned that they didn't want to be a bother and they didn't want to burden services that were already stretched. I find this particularly heartbreaking. These are individuals who harm themselves, who may need, they may want, and they certainly deserve support. And they find that and can find it difficult at the best of times, let alone during a global pandemic. So just to pick up some comments in the next couple of clicks here from people. Somebody said, depending on how serious, I'm certainly less likely to get help now. I'd feel bad for using NHS services while already stretched, and I'm scared of being called selfish by people for taking up much needed NHS resources during COVID-19. Somebody else said, sadly, staff attitude is nasty at the best of times. I wouldn't want to face that now. So these are a group of individuals who may already feel a sense of stigma and burden, who are perhaps feeling it even more heavily now. And we know that they are presenting less at medical services, but again, what we've seen reflected in the number of people coming to us as a community service has been significantly higher than we would ever have seen in the past. So moving on. I just wanted to pick up really a bit of our client voice. Really, as a user-led service, we're quite keen to give these anecdotes a bit of weight behind them with real people, just to bring to home the fact that behind these numbers are individuals in distress. So this is an example of one of our clients who was already engaged with our support services and had gone home for Easter. They're a university student here in the East Midlands. They'd gone home for Easter just prior to lockdown, and then lockdown was implemented, and they remained there then between March and September due to the lockdown and the way that the virus was affecting universities. They found that obviously they were away from their friends at university. They had less day-to-day structure in their life, and their social interactions were hugely decreased because of the lockdown restrictions. They were locked down in their hometown with their parents, and unfortunately for this client, their experience was that their hometown had been where they historically experienced sexual abuse, and that past trauma was very much brought into the present because of the physical environment they found themselves in, which hugely increased their sense of rumination, their suicidal thinking, their fixation on their experience of trauma, and their self-harm urges were incredibly strong and growing. And what we saw for this client was that they had an episode of self-harm. So albeit the frequency wasn't significantly huge in number, it was significant because this client had come to self-harm 1 year after their last episode. So their distress trajectory was quite rapid through lockdown specifically. So what did we do? Going on to the next slide. One thing that we do quite well, I think, in community services is respond really flexibly to need, and that's certainly what we did for this client. We supported through different remote means. We asked, what would you prefer? Video calls, securely, phone calls, text, what would work best for you? And for this client, that flexibility and provision was really gratefully received because they were incredibly anxious to do video calls. So we gave remote support here by phone and by text. And we made sure that depending on that need, wherever it wavered, wherever it had peaks and troughs, we were there to respond to it as quickly as we could. One thing we did very practically was review their safety plan. And through the whole process of those months between March and September, we saw this client's suicidal thoughts significantly decrease, and so far to date, no further self-harm. And really that just shows that we need to listen to clients and what they're telling us and try and implement those changes in line with what they need very quickly, wherever possible, especially during a crisis like this. So moving on. What next? So there are a couple of points here that I'm going to bring up. And one of the things, speaking from a third sector service, is that we know this is where people are at the moment during COVID presenting. So there's an issue here in that where people are presenting is not resourced appropriately, and a heavy reliance at the moment on the third sector is not necessarily sustainable. It's not going to survive the COVID crisis with limited funding streams available. So a key point for us and other services doing similar work is we need more broad investment in self-harm prevention services. And we can especially see, and I'm sure we will through further research, through the multi-centre study and services like our own and through NSPA work, that Covid-19 has had a significant impact at a time where we know self-harm and suicide look to be increasing and where people are sort of voting with their feet and going to the third sector. But when this sector is under such strain, we do need to have another revisit and a look at sustainable responses to need before it's too late. And what we can all take a part in is continuing to engage with our existing clients and the people that we know are in distress to ask what they need and what they want, and wherever possible to provide that, to give them some hope for the future. So then moving forward to that last slide. These are our details. So if you do have any further questions specifically for our service, here's where you can get in touch with us. Thank you.